course, we had to move things a little bit this week, given the change in the schedule since the Democrats shut down the legislature at the end of last week to pass their majority budget. And so session was canceled yesterday. So glad you're here with us today to talk about a very important topic, and one that I think is incredibly timely given all of the input from the public that we heard on Monday. I'm sure you're aware of that at the public hearing. And that topic is vaccine mandates in the state of Maine and our general opposition to them. So I'm going to turn it over to Lisa Kime, who's the Assistant Senate Republican Leader. And after Senator Kime's done, then Senator Moore, Senator Libby, and then we'll be back with you at the end for Q&A to talk about that subject as well as any others that you have. So if you can hold your questions to the end, that'd be great. With that, I'll turn it over to Senator Kime.
Thank you. Good afternoon. As Republicans, we are here to stand in support with the droves of people who came out to speak and really plead that their freedom of conscience be restored. They shared agonizing stories of lost educational opportunity and lost livelihoods. The problem with mandates is that they force Maine people to rely on big pharma and the government to make their healthcare decisions. Maine people are not willing to do this, and the sacrifice to them after our removal of philosophical and religious exemptions has been a really high price for them to pay. And after this incredibly moving time, what we get from Maine public in response is this really unjust and an awful headline that is so, it makes me so angry to see that Maine public, who gets Maine taxpayer money, would put in their title that as Maine lawmakers consider changes to vaccine mandates, debunked conspiracy theories take hold. That was not a day of debunked conspiracy theories. That was a day of heartbreaking testimony of Maine people. This is absolutely wrong way to categorize this day. And recently, what's come out with the Twitter files to actually prove that these are not debunked conspiracy theories is that the federal government was working with Twitter to suppress any information about vaccines if people were having adverse impact. And they have estimated, and they haven't fully gone through all the files yet, but it's been estimated that 10 million people, which is about the entire population of northern New England, have had their accounts highlighted, and they are categorized as spreaders or super spreaders or names such like that, depending on the reach that they have on social media. So I think it is up to the media to do their job and look into what's really going on and respect the Maine people when they come to tell us what's happening in their lives and what's happening with vaccines and the mandates. And with that, I think I'll be turning it over to Mary Ann Moore, who will talk to you some more about this issue. Thank you.
Thank you. Good afternoon. And I will just be brief. I wanted to point out that we have, in the state of Maine, we have our state guidelines for healthcare workers that is requiring the COVID-19 vaccine with no non-medical exemptions. And as a result of that, when we take a look at the federal CMS rules, they also state in there that they do require anyone who accepts Medicare or federally funds must meet these requirements, and CMS has outlined that the COVID-19 vaccine is a required vaccine unless there is an exemption. So here we are in Maine. We are one of 6 states that does not have any non-medical exemptions. And it's not good, it's not fair, it's not correct. And when you start looking at the CMS rules, they date back to November 5th of 2021. That's how old it is. It has not been updated. It has not, they give us some different directives and they'll send out bulletins, but it's still requiring the COVID-19 vaccine that we have not even, it hasn't even been around long enough for us to know how it is. Now here in the state of Maine, we gladly, our community colleges remove the vaccine requirement. Our University of Maine system removed the requirements. However, I had a situation the other day that was brought to my attention where we have a young woman who is applying for nursing school. We have a desperate workforce shortage of nurses. We need them. We need the workforce development. And unfortunately, she is unable to attend the nursing school because she's going to be working in healthcare facilities, and they must follow the guidelines that are required for our healthcare workers. So she's not even able to start the school or start the class because of these mandates and the requirements. So the bills that we have before us today will give us an opportunity to expand our exemptions and maybe give the opportunity for young women, as Sarah, to be able to go to school and to do what she so desperately needs. So at this point, I think I'm going to turn it over to Senator Libby.
Thank you. As a member of the Education Committee, I sat through about 12 hours and 10 minutes of some pretty compelling testimony, and I thought that one of the really compelling pieces of testimony came from a Portland firefighter who was fired from their job, and they had 10 years experience, but they were previously covered by a religious exemption, but then it was taken away. There were so many other cases like that: a pulmonary bedside nurse, a paramedic from Phillips, who had a daughter who had to move to Texas to take employment or wanted to stay here. It was on and on and on. So one of the things that I asked the Maine CDC was, look, if all of these students who are involved in all kinds of extracurricular activities, and not just school, but out of school, and things like AAU programs and so forth, if they're going to other states and they're competing against other players from these 44 states who have religious exemptions and who have personal philosophy exemptions and medical exemptions, and here they are competing against each other, breathing on each other, banging into each other, you name it, and somebody hasn't had a measles vaccine in one of those states or something like that because they've got an exemption. How is it that tiny Maine should be different and not allow any exemptions when these kids travel and they intermingle, and obviously they're exposed to other children? So I asked the Maine CDC that question. They couldn't answer it. We'll get back to you at the work session. If you think about, from just a common sense standpoint, how ridiculous it is for Maine to not allow religious and personal philosophy exemptions and have all these other states have them, and we all intermingle. I mean, and God knows when you go on a plane, you're afraid you're going to catch a cold, that's for sure. You get that recycled air all the time, let's face it. But it's, so if you break it down that way, and you think about, okay, what is the reason that we have this rule in place? I find it to be discriminatory. I think it's pure discrimination because some people don't like the people who are saying we deserve a religious exemption from these vaccines. We deserve personal philosophy exemption from these vaccines. It is discrimination, no matter how you look at it. Those are my comments. Thank you very much.
And Eric, I know you've got a bill and you want to highlight that real quick. Go ahead.
I'd love to speak to it. I do have a legislation in that is specific to the COVID-19 vaccinations, which I think it helps a little bit to understand what the actual science has been. There has never been compelling scientific basis for COVID-19 vaccination mandates as public health policy. And you had very highly regarded epidemiologists, folks at institutions like Harvard, Stanford, Oxford universities, who spoke out early about this, and what happened to them? They were blacklisted on Twitter. They were censored because they were undermining the political consensus around these vaccination mandates. You look at someone like Dr. Jay Bhattacharya of Stanford University, who actually advocated very early on, even before there were COVID-19 vaccinations, that the best thing possible in healthcare settings where you're dealing with vulnerable populations was to recognize that there is such a thing as natural immunity and to have healthcare workers who have that natural immunity be the ones working with vulnerable populations, because that is what would give protection to those vulnerable populations. And yet those healthcare workers were fired from their positions. I know a gentleman up in Aroostook County. His name is Adam. He worked as a physical therapist at a local nursing home there for close to 2 decades. When others were afraid to go in and work with COVID positive patients, he said, I have an obligation to my patients. I am going to go in and I am going to work with them. And what happened? He contracted COVID. He did the right thing. He went home for 2 weeks. He got healthy. Then he went back to work and he kept working, like so many other healthcare workers across this state. And in 1 year, they're heroes. And the next year, they're being summarily fired from their job and told, you're not welcome back. And now we have a healthcare workforce shortage. And you gotta wonder why. You know, by some estimates I've seen, we've lost between 5 to 10% of our healthcare workers as a result of these COVID-19 vaccine mandates. And yet when we go and we talk to bureaucrats at the hospitals, when we talk to bureaucrats in the government about how we're going to deal with this healthcare workforce shortage, it's like the big elephant in the middle of the room that nobody wants to acknowledge, that we just fired a huge chunk of our healthcare workforce. And so many of them are ready and willing to come back to work, except for these ridiculous mandates. Here's the thing with the COVID-19 vaccine mandates. It was, the evidence suggested early on, and as time has gone on, it's recognized by everyone. The COVID-19 vaccines never protected against infection and transmission. And that was the whole argument when I chaired the Health and Human Services Committee for years. That was the whole argument for vaccine mandates, was that with traditional vaccines, is that they would contribute to herd immunity. But according to Dr. Jay Bhattacharya of Stanford University and many studies that have come out corroborating this, these vaccines do not contribute to herd immunity. The best they ever did was provide individual protection, but you were not protecting others. And you know what that is? That's a personal health decision, not a public health decision. That's a decision that an individual should be able to make in consultation with their own physician about what makes sense for them. Not to be decided by Governor Janet Mills and President Joe Biden and Dr. Anthony Fauci with a one-size-fits-all approach overriding people's basic rights to bodily autonomy. And so the legislation I have in would prohibit these types of emergency use authorization vaccination mandates imposed upon students in public institutions of learning. The lessons we have learned from what has taken place with this COVID-19 vaccine mandates is that we should never allow government ever again to force emergency use authorization vaccines that have not gone through the proper tried and true testing processes. We should never force that and mandate that on anyone. It's one thing to make things available in an emergency situation and give people the choice. It's another thing to take that choice away from them and force it into their arms, whether they like it or not, and threaten to fire them from their jobs and kick them out of school. This has been a terrible violation of human rights. It is contributing to our workforce shortages. It is contributing to denying students the right to a basic education, and it has to end. And I plead with Governor Janet Mills to lift these COVID-19 vaccine mandates on our students and our healthcare workers, and let us learn the lesson and say never again. Thank you very much.
So you'll hear from other Republicans as well throughout the session that also have their own pieces of legislation. And I think Eric's is a really great idea. I know there's some on the House side as well. I'm glad our House cohort is here with us today as well to just echo the same refrain. With that, we've got a little under 10 minutes left. Happy to answer questions from the media about this topic and any others that you want to talk about this week. Yep.
Do you or does any member of the caucus, Senate or House, have any reaction to the admission from the Attorney General of his improper relationship with a subordinate for 8 months?
Yeah, we haven't actually had a conversation with our House counterparts yet. In fact, I found out about it literally as we were sitting in session. The more I read, the worse it seemed to get. We'll have a formal statement, though, for you in collaboration with the House here later today, and I point you towards there and look forward to talking more about it. Yeah, go ahead, sure.
As the senator said, we'll be putting forward a formal, response to those. I don't know if they're allegations, more admissions from the Attorney General, but I will say that I'm deeply concerned what I've heard about the Attorney General's behavior from his supervisory position to be having relations with someone in his employment. It's very concerning and disturbing, and I've got concerns with him being in that position after committing conduct like that.
What else you have? Is somebody trying to say something on the Zoom? What else from the audience?
Good.
Okay. No questions. We covered a lot of ground. Thanks, everybody. Appreciate it. We'll see you next. We'll be back on our regular Tuesday schedule next week, so look for us Tuesday, 12:30. Thanks.